Hello again. Welcome to the next video in our series for Duchenne education, brought to you by the CureDuchenne Cares program. My name is Jennifer Wallace. I am a physical therapist and owner at Duchenne Therapy Network. Today we will be continuing our pulmonary care series with more advanced pulmonary management of Duchenne.
My name is Jane Taylor. I'm a pediatric pulmonologist here at Children's Mercy, Kansas City, and I'm the pulmonologist who's part of our multidisciplinary Duchenne's Muscular Dystrophy clinic.
Let's start off with, why do people with Duchenne have greater problems with their respiratory system?
So patients with Duchenne's muscular dystrophy run into problems with their airway clearance because they have weaker respiratory muscles. So the actual cilia and mucociliary elevator works fine. That's not affected by muscle weakness. But when you have weak muscles, it's harder for you to take deep breaths to help move the mucus up and out. And also, once it gets more towards the middle airways, to cough the larger pieces of mucus that glob together up out of the airway system. And if it stays down there, you have increased risk for infection, but also it can become sticky, kind of like bubble gum, which can get stuck in the airways and cause part of the lungs to deflate, which is called atelectasis. And when that happens, it's harder to bring the oxygen in and the carbon dioxide out.
What is an ineffective cough?
We have shown that there needs to be a certain amount of pressure that your body generates using the respiratory muscles to take a deep breath in and then force the air out. And that's what helps move the mucus up and out of the body. When your respiratory muscles get to a point of not being able to generate that amount of force, we can't get the mucus up and out of the lungs.
What is aspiration?
So aspiration is a word that we use in the medical community to indicate that something from up above the vocal cords has fallen down into the lungs that shouldn't be there. And aspiration can be on any liquids that you might drink, food particles that you have chewed up and are trying to swallow, or also just your spit or your nasal secretions when ill. So many different things can cause aspiration. But when in small amounts, it can cause increased inflammation, increase mucus production in the lungs, and increase your risk for infection long term. If there is a large aspiration event, so a major amount of liquid food or your upper airway secretions down into the lungs, it can cause pneumonia, usually within about 24 hours.
What is nocturnal hypoventilation?
Nocturnal hypoventilation is a medical term for not being able to take deep enough breaths to make sure you get enough oxygen in and carbon dioxide out while you're sleeping.
What is respiratory failure?
Respiratory failure is a medical term that we use when your respiratory muscles have weakened to the point where you're not able to take large enough volumes of air to keep a normal oxygen level in the body and normal carbon dioxide levels in the body. And that is the time where you need some respiratory support with the non-invasive ventilatory support.
What treatments are commonly used for someone with Duchenne?
So some of the common pulmonary equipment that will be prescribed for a child with Duchenne's starts with the cough assist device. And this is a machine that actually helps increase the pressure and then the pull with a patient who is actively trying to cough. And there's a mask that goes over the nose and the mouth, and that will help bring that mucociliary elevator or the mucus layer up and out to a point where then the patients themselves can cough it out or it can be suctioned out. When the children have issues with nocturnal ventilation, which is when they're sleeping at night, a lot of their respirations are going to be more shallow and they're not going to move the same volume of air, so it's harder to get enough oxygen in and carbon dioxide. And it usually will start with something called CPAP, which gives a little bit of constant pressure. So when the upper airway wants to collapse, it keeps it stented open. As the children weaken further, usually we need something called BiPAP support, and that has the one constant level, but when the machine senses that a patient is trying to take a breath in, it will actually increase that pressure to make sure they're moving larger volumes of air, which means more oxygen in and more carbon dioxide out. And that can be delivered as either a non-invasive ventilatory support, which is through a mask that goes over the nose and mouth, or through a home ventilator unit, which also can sometimes be used with a tracheostomy, which is a tube that's placed in the throat. And the decision on which one to use is up to the families. And originally it is an issue just with nocturnal ventilation when you're sleeping because you naturally are taking smaller breaths, but ultimately it will progress to needing support when you're awake and asleep.
Our most sincere appreciation for Dr. Taylor's time and expertise on these subjects. We do hope that you find this information helpful. Stay tuned for part 3 of this pulmonary series, which will cover sleep studies. Subscribe to this channel to get notifications when new videos are released. You may contact us at the information above. And thank you to our sponsors.